Imagine yourself needing medical attention while traveling abroad. They cover you with flowers and start chanting. That's probably not something you'd expect after having received medical attention here in the United States. This is a prime example of how different cultures do things, well, differently. Today we'll be presenting nursing considerations in the Arab culture. We will discuss the beliefs and practices and explore the rituals and traditions to gain further insight into this male-dominated society. We'll conclude with care considerations and potential issues that might arise while providing care to patients within the Arab culture. Now, as Madeline Leininger made this important connection, cultural differences between caregiver and care receiver must be understood.
Good health with an emphasis on personal hygiene and healthy diets are highlighted within the Arabic culture and the Islamic religion. Commonly, both males and females and their children prefer to be seen by a male doctor. Due to women being reluctant to discuss pregnancy or gynecological needs with men, they prefer to be seen by a female doctor when it comes to those areas of necessity. Nurses are looked upon as helpers, and their words are rarely taken seriously by Arabic patients. At times, doctors may intervene and explain exactly what role a nurse plays and the importance of his or her role in that patient's recovery. Unlike American standards, it's common within the Arab countries to withhold undesirable news regarding the patient's well-being. Instead, doctors may only provide patients with good news about their diseases. Severe cases demand to be reported, in which case the doctor assigns a family member to educate and disclose the seriousness of the situation to that patient. It is common for Arabs to wear amulets for protection against the evil eye, or will burn incense to keep the evil eye away from the sick. Such practices are declining and are used primarily to avoid illnesses and harm to a healthy person. Also, prayers and readings from the Al-Quran or the Bible help give comfort to patients and family members and enhance the patient's recovery. Arabs turn to the Islamic law for a set guidelines as to what is considered clean and unclean within the dietary realm. The Islamic jurisprudence identifies which foods are placed in one of the following two categories: halal, which is lawful, and haram, which is unlawful. According to the Quran, the only food explicitly forbidden are meats from animals that die of themselves, blood, and the meat of swine. It is unacceptable to eat an animal that has been killed by boiling or electrocution. To be deemed acceptable, the animal must be slaughtered by a Muslim and hung upside down long enough for the blood to be completely drained from the carcass. The Quran contradicts the degrees of zero tolerance for consumption of alcohol beverages or any intoxicants by forbidding it in some verses, but later revealing that in fact alcohol contains some good as well as evil. Most observant Muslims keep away from any food products listing vanilla extract or soy as their ingredient.
Hi, my name is Natalia, and I will be talking about birth, death, and communication practices among Arab culture. First, about birth process, it's important to know that the Arab women are particular about their doctors when it comes to pregnancy, especially when the doctor is a man. The head female of the family house will typically request a female doctor to perform the procedure. So women will typically be closed for their pregnancy, but they will be exposed from the hips down to where is only needed for the procedure. As an 1800s tradition, Muslim women typically use a birthing chair for their process, and these are typically used for house or home pregnancies with the assistance of midwives. While the baby is being born, he or she will hear the call to prayer. as that being the first thing that they hear. This prayer opens them up to the awareness of Allah, which is God. A 7-day naming ceremony is held for the baby. The whole family is gathered, and they pick out an Islamic name for the child, and is usually followed by meal, sacrifices, readings, and they will typically cut off a piece of the infant's hair. An Arab person, however, who is preparing for death will typically pray to Shahada. Shahada is a prayer which expresses the worthiness of dying for Allah. When a person dies, they wash their whole body and they're buried immediately. They're usually buried facing Mecca, which is a direction that they have to be facing for their direction of prayer to Allah. Memorial services are typically held from 7 days to a year long. For the as for communication, it is customary for a person of Arab descent to stand 2 feet away from the person that they are conversing with. They will avoid physical contact, and they will stand with their hands behind their back. It's important to know that it's inappropriate to cross your arms or have your hands on your hips when having a conversation. It's important to know that shaking hands is very appropriate. However, it's inappropriate when it comes to shaking hands with the opposite sex or looking into the eyes of someone who is the opposite sex, because that can also be seen as degrading. It's insulting to show the soles of your feet and not take your shoes off while you're in a house or a mosque. And also, if you're a visitor in a home of an Arab, it's important to know that if you are not greeted in their house, then you're not welcome. If they're not having a conversation with you or didn't say anything to you, then you know that you're not welcome in the household. And that's all I have for my 3 topics: birth, death, and communication.
Moving on to rituals and traditions of Arabic culture. The role of Islam. Arab culture means there's a connection to religion and society of the Islamic world. Men are more powerful than women, and they can actually have up to 4 wives. Both are standards in Arabic culture. Many Arabs follow the Quran, which is a holy book or a guide of the Islamic and Arab tradition. Arab culture can be complicated when it relates to healthcare due to the rituals and traditions from the Islamic Muslim culture. Women are required to be covered wearing either a hijab, which is a headscarf, a black headscarf that must cover their head and hair. And then there's also something called an abaya, which is more strict. That's a full-length black cloak. Everything from head to toe is covered on the women. The only thing exposed are the eyes. Islam is a part of the Arabic daily life, the way they dress, the way they eat, the way they pray, the way they greet. Their culture and religion sets the guidelines for relationships, care, and health care, among other aspects. Men and women are treated differently in healthcare, which can lead to misdiagnoses, dissatisfaction, and poor understanding of healthcare plans, especially of Arab women who are in the Western environments. Moving on to nursing considerations. Understanding and patience is something that's very important for nurses to know, especially for Arabic patients. They have to become familiar with the needs or any special requests. However, they must also know what is ethically correct in the workplace and consider that while making decisions for their patients. Become familiar with prayer time so they can schedule med passings appropriately throughout the day. The nurse must also be aware of the modesty aspect of the Arab culture and maintain a safe and friendly environment for the patients when they are exposed to an open environment of people.
Some potential issues to keep in mind when dealing with a patient of Arab culture is that the left hand is considered unclean. The healthcare provider should use the right hand to administer forms, medications, and treatments. Ramadan is a large part of the Arab culture. It is the 9th month of the year where they fast from dawn to sunset. Verify medication schedules and intake during Ramadan, as daytime medications may be omitted by the patient. Praying is a big part of the Arab culture. Allow your patient time to pray throughout the day with absolutely no interruptions. In order to provide culturally astute care, nurses should try to familiarize themselves with the vast amount of religious and ethnic groups within their community. The United States' ethnic composition is changing every day and will become even more diverse as we embark on our nursing careers. Religion and faith, health and illness, life and death are all intertwined for most people. To perform an accurate assessment and provide competent care, the future caregivers and nurses must incorporate the patient's cultural and religious beliefs more and more into their plan of care. The Islamic faith may be unfamiliar to many of us in the West. However, growing numbers of patients are members of this faith and culture. Ask questions. No one is offended by answering questions and educating you about their needs. People become offended when you do not take their needs into account.